So we're here today to do the next Blonde Docs podcast, and we're going to be talking about puppies.
Puppies, the best. What do you always tell your clients when they bring in a new puppy?
My top things are like to talk about the potty training and the chewing.
Yeah.
Heartworms and parvovirus.
Parvovirus.
Yeah.
Yuck.
Those are the things I really like hit on every time.
Helpful puppy tips.
Yeah, exactly.
Yeah. I think I always talk about puppy food, when to get them spayed and neutered, birth defects, and that's pretty much it, I think. Yeah. So we got some good stuff.
Yeah.
Yeah. What do you want to launch into first?
Parvo, I guess, because I feel like that's one of the most important. I'm just like, don't take them any public dog area, like PetSmart, dog training, grooming, to the park, anything like that until 2 weeks after their final set of vaccines. So they get their last set of vaccines at 16 weeks old, and then 2 weeks after that, they're technically protected and they can go into public dog areas.
Right.
But parvovirus is it's very contagious. It can live in the environment for a really long time. I even am like worried. I mean, if you live in an apartment or something like that, I'm like, I hate to tell you to keep your dog inside for, 16 weeks, but I'm also like, okay, if you have an area that nobody walks their dog, and just to tell them about the signs to watch for. Like parvo, they're very obviously sick and need to come to the vet. They're vomiting, diarrhea, not eating. They all almost always have to be hospitalized. It's very serious.
It is super serious and scary. And it would just suck. Like, you get a new puppy and they get sick. That would be terrible. So no fun. And then I think there's a lot of misconceptions, because I think people are like, well, my puppy got a shot. But it's like, you have to complete the whole booster series before they're fully protected. So until they're 16 weeks old, it's like, you're at risk. So even though you maybe even got one booster, you can still get it.
Yeah.
You know what I mean? So I definitely think that's something that people don't always know.
Yeah,
you know what I mean?
They get from a breeder and they're like, well, they had some vaccines. And you're like, well, they need multiple sets.
Yeah, exactly. And I think that's a good way to bring up that, it's, at least the way I do it, is I usually start at about 8 weeks old. Really doesn't matter, I guess, as long as they're older than 6 weeks. And I do my boosters every 3 weeks until they're 16 weeks old.
Yep, that's what I do.
Yeah, nice. But it's just good to know and talk about, because I feel like people don't always know that, you know what I mean? And they also don't know that 16-week mark is so important, you know what I mean? Like, that's when their own immune system kind of takes over and says, okay, I got this, you know what I mean? And that's when those vaccines really do what they're supposed to do.
Yeah.
But yeah.
100%.
Good stuff.
And then what else? And then heartworm prevention's another thing. People don't really, if you didn't grow up with dogs, or if you're not in the vet field, we don't get heartworm, so it's just not something you really know about. So
that's true.
I'm like, they have to be on heartworm prevention every month for the rest of their life. Whenever they're 6 months old, they can get a shot that lasts 6 months. When they're a year old, they can get a shot that lasts a year. Yeah. But that's important too. And whenever they're a puppy, coming in for those monthly visits, so you can weigh them and give them the correct, dose for their weight range.
So true. And what's nice about here, I guess, is whenever the puppy comes for their first visit, they get their first dose of heartworm prevention free.
For free.
That's pretty nice, you know what I mean? And the one that we use does heartworms, which I think another common misconception, or at least I get this a lot, I don't know about you, but they'll be like, so whenever you check their stool, was there heartworms in there? Yeah. And I have to be like, no, that one's in the bloodstream. Yeah. We don't know, you know what I mean? So I think that it's not something that we would detect in a stool sample we would maybe other worms that puppies could have. And I think that, the best way to prevent it is that heartworm prevention that you give them once a month. You start it when they're just little babies, and that's okay.
Yeah, and it does protect against a lot of the stool worms too.
That's true.
Heartworm prevention, so.
Yeah, good point.
Yeah.
Hookworms, whipworms.
Roundworms, maybe.
I think.
Yeah.
And then, so that's definitely super important. Puppy food, I always recommend that people keep their puppies on puppy food the whole first year of their life. And even in some large breeds, I'll say the first 18 months. You know what I mean? Yep. I think that's super important. And it needs to say puppy on the bag. It's important because they have certain nutrients in it that maybe other dog foods don't have that can help your puppy grow. Or it can say all life stages, but I prefer a puppy food.
Yeah.
Yeah. So that's another thing that I like to talk to people about. Another thing that I think is super important for that first visit when they come in is we're all going to check your puppy for different birth defects. You know what I mean? There's a lot of things that your puppy could be born with that you wouldn't know to look for, you know what I mean? So, you know, just like human babies can have soft spots on the top of their head, puppies can have that too, you know what I mean? Just like human babies can have hernias and things like that, so can puppies, you know what I mean? Heart murmurs. So that's why that first visit is so important, because we can check for a lot of these things. So even things like, you know, we may not know that they have yet, like, I mean, they're definitely looking for symptoms of parvo and stuff like that, but we can check for other things that they can carry with them longer in life. So that first puppy check is pretty important.
Yeah. I talk about vaccine reactions just after I give vaccines. I mean, that could happen at any visit, but usually it would show up at a puppy visit. So I just tell people to watch them for the next few hours for vomiting, facial swelling, hives.
Sure.
If that happens, bring them right back. We'll give them a steroid injection and we'll note that they're allergic to a vaccine.
Makes sense. Yeah, we do the same thing.
Talk about chewing, talk about potty training. I mean, every dog's different. Like some dogs are super easy to potty train. Some dogs you get from the breeder and they're already potty trained.
Yeah, good point.
Some dogs don't really have an issue with chewing anything but their toys. Some dogs, you know, I always chew all the corners of your house, and all your furniture, and all your shoes, and they swallow everything.
Exactly. Like some people get really lucky and they get these puppies that don't chew on anything, and I'm like, good for you, because that's not been my luck. But I think that, you know, I usually tell people that if you get a puppy, like anything you love or hold dear, like pick it up off the floor because they may destroy it. I don't know. And then my tip for potty training, I don't know what you usually say, but like I'll be like, limit the amount of space they have. Does that make sense? Like if you're in the kitchen, they're in the kitchen with you. Or if you're not at home, maybe use a crate or something like that. Because the more space the puppy has to roam around, the more likely they are to find a little hidden spot and leave you a present for later. So I think
I usually say
nice.
Supervise or confine. I'm like, if you can't like supervise them and catch them in the act and like interrupt that act and say like, no, and bring outside, let them finish outside. This is the ideal situation.
Sure.
Interrupt, let them finish outside, give them praise, give them a treat. If you can't supervise them, then confine them to a smaller area, to like a crate or to a smaller area anyway, because they're less likely to go to the bathroom in their own kennel and stuff.
Sure.
And then I tell people it's important to like catch them during the act, you know, to interrupt them.
Yeah.
Because I'm like, if you walk over to like some pee in the corner that happened 10 minutes ago, they like, supposedly dogs don't really make the connection that well of you fussing at them and pointing. They might know they did that, but they don't realize like, oh, pee, not inside.
Right.
Like, they don't get it.
They're not making the connection.
Yeah, it helps to like interrupt them, let them finish outside.
Yeah.
Anyway, this is all ideal scenarios.
Sure. But I like it. Supervise or confine. It's like a
Supervise
good way
and
to
confine,
remember it.
that's what I say.
That's good. And then, so that's good, like behavioral stuff. And
then like frequency too. Like just like human babies, like they need to potty a lot more frequently. You know?
I agree. Yeah, like some people will like even wake up in the middle of the night and like take their puppy outside, which I'm like, good for you, but just like a baby, you know what I mean? But I think when they're really little, especially small breeds, just because their bladders are smaller, almost taking them out like every 2 or 3 hours when you first get them. I mean, it's a lot.
Or even like potty training a kid, like you need to frequency. Like they're gonna get it better if you go outside much more frequently.
Yeah, I think that makes sense.
I usually say to feed more frequently too. Like I try to, big dogs it's not as important, but I usually say twice a day at least. And then, if it's a small puppy, 3 times a day if you can.
I feel the same way. Yeah, like those little Yorkies or Chihuahuas, they tend to get like low blood sugar if they don't eat frequently enough, and just almost keep them like Karo syrup or something on hand. They start looking like they're getting a little weak. Maybe rub some on the guns. I don't know. Yeah, but usually if you get like a little dog like that and get it from a breeder, they'll mention stuff like that too. Yeah. You know. But yeah, and then one other thing I wanted to talk about was spaying and neutering and like when to do that.
Yep.
I feel like there's like, not controversy, but it's a little, at least kind of.
It's not like cut and dry rules.
I agree.
It's like it depends on the owner, it depends on
the breed.
The breed,
yeah, size, all that stuff. So like for me, and maybe your opinion is different, I don't know, for a large breed dog, like my golden retriever, my rule of thumb for her was 1 year first heat, whichever comes first. And that for me was like my marker of when to get her fixed, when to get her spayed. And the benefit of that is because like her, joints are getting the benefits of those hormones circulating. There have been some studies that have come out that have shown that there are some cancers they're less likely to get if you wait a little bit longer. Downside of that is every heat cycle you wait, they're more likely to get things like breast cancer, things like that. So it's kind of like this fine line you got to walk with big dogs. Whereas little dogs, it's like 6 months.
Right.
Get
Little
'em spayed.
dogs, it's like 6 months. You don't have to deal with the heat cycle. Big dogs, if you could deal with one heat, that would be nice. That's usually what I say. I usually say 1 year, but if owners are like, I absolutely do not want to deal with a dog going into heat in my house, all that stuff, then I'm like, okay, let's try and like do like 8 months, because they usually go into their first heat. I usually say between 8 and 12 months.
Yeah.
And I hate to tell somebody 10 months and then at 8 months their dog
Exactly.
is in the heat or something.
You're like, sorry, thought
Yeah.
it was going to be a little longer.
Male dogs, I really try to wait little dogs 6 months. Big dogs, I really try to wait a year for the same benefits for like arthritis and like cruciate ligament disease and stuff like that.
Sure.
But if they start having behavior problems like aggression or marking, like urinary marking in the house or something like that, then I'm like, okay, we can neuter sooner.
Yeah, I say the same thing. We're on the same page.
We're saying the same stuff.
Amazing.
We didn't even know.
But I'm trying to think. I feel like we covered a lot of the things. Helpful
know.
puppy tips. Well, I can talk a little bit more about food. I'm trying to think. I don't know. It has to do with calcium and phosphorus, but I don't know all the specifics.
Oh, yeah, no.
I just tell them that, like, specifically if it has puppy on the bag, they are like legally required to meet certain standards.
It has
like
more
the AFCO
protein,
statement.
more fat, more calcium probably, and phosphorus for bone growth.
Yep. And it's just a little bit, it's definitely higher calorie. So, and this is an interesting thing too that kind of ties in with them getting spayed and neutered. It's like usually once you get them spayed and neutered, they tend to gain weight just because
their metabolism is slower after that.
Exactly. So around a year is when you get them spayed or neutered. Around a year is when you maybe want to switch them to adult food, because if you get them neutered or spayed and they're on that puppy food, they're going to start gaining weight like crazy. So that helps a lot. But yeah, I think it's just like the nutrients that it provides. It's really important that they're on a puppy food that whole first year of their life. It helps with their development and growth and things like that.
Another important thing. Did we say this? About grain-free?
I don't think we mentioned it. Yeah.
I would not do a grain-free food.
Yeah.
They're like all the rage right now, but dogs need grain, and there's a lot of studies that have come out that have linked grain-free diets to heart disease. So I tell all my clients, like, get
Just
a food
avoid
with
it.
grain.
Yeah.
Avoid grain-free.
I agree. I feel the exact same way. I'm very anti
Yeah.
no grain.
Anti-no grain. Pro-grain.
We want grains in there. Yeah. Dogs are not, true carnivores. They need some grains in there. So I think it's good that start them out strong. Don't start with a grain-free food.
I agree.
Yeah.
Also, heartworms. I don't, it's important to be on a heartworm prevention in South Louisiana, because heartworms are spread by mosquitoes.
Right.
It's pretty much like if your dog is not on a heartworm prevention, like it's not like if they will get heartworms, it's when, is what I feel like.
That's a great point.
Some people get very lucky and they have like a little Yorkie that only goes outside like a couple times a day to potty, and I don't know. These people get very lucky, but I see tons of indoor dogs that have heartworms.
Because it's like, I know I've seen mosquitoes in my house before, you
Yeah,
know what
exactly.
I mean? And it's like, even if they never go outside, it's just, we have the population of mosquitoes here is so crazy, because of the water and stuff. So it's just, I totally agree with you, not if, when, and the sooner we can start them on heartworm prevention, which most preventions, the safe range is like around 8 weeks to get them started. Some of them are 6 weeks. But, the soonest we can get them started on something, the better.
Yeah, I agree. So I was talking about parvo earlier, and then like, some breeders will give you your dog and say like, okay, this dog cannot touch grass or be around any other dog until it's fully vaccinated. But I'm like, if you live in a home that isn't like, you just moved in 6 months ago and you don't. Anyway, I'm basically trying to avoid parvo.
Yep.
So if all of your dogs are healthy, they're not vomiting, they're not having diarrhea, they're fine, and they're fully vaccinated. Like, it is totally fine for your puppy to mix with those dogs and to be in your house, in your yard.
I agree.
But if you move into a brand new house, like a rent house or something, and you don't know who lived in that house, and if they had a parvo puppy 6 months ago, then I would say that's a more high risk situation.
Because it lives in the environment for a long time.
Yeah. I think, I may be wrong, but I heard that it could live in the environment for over a year, even after like rain and sunshine and all that stuff.
Yes.
Like, it needs bleach to kill it, and how do you can't bleach your grass. So,
Right. You got to kind of know your environment, and if like it's a house you've lived in forever, and
then
you know
it's
there
safe.
was, exactly,
You
put them in the yard, doesn't matter.
Puppy that you just had a parvo puppy that was hospitalized or passed away or something like that.
Exactly.
Then you're fine.
Yeah.
And then people are always concerned about introducing puppies to their new pets. There's no, I just tell people like positive reinforcement, and then like slow introduction is best if you can. Like if you're bringing in, I don't know what you tell people, but anyway, and I'm not a dog trainer, so I'm sure like people from Zen Dog would be watching this, and they have way more tips than me.
Yes.
But I just tell people like, you know, make it positive for both dogs. Maybe make it in an area that's not like, you know, don't bring the puppy right into the house, like the other dog's territory. Like maybe not let them meet out in the yard. I mean, ideally, if you could introduce them at a park or something, that would be cool.
Like a neutral territory.
Like a neutral territory,
Yeah,
exactly.
I think so.
And then like give them both treats and give them both a lot of attention and praise and just try to make it a positive experience.
Right. And I find, I don't know, and I don't know if like you have this experience too, but like older dogs tend to, like if you were to introduce an older dog to another older dog, that can sometimes be more difficult, especially if like your dog is reactive. But I find that like if you have an older dog and you're introducing it to a puppy, for some reason they just like tend to do
They're
better.
Like, that's a kid. It's
yeah,
fine.
it doesn't know that it's
doesn't
acting
know.
crazy or something. You know what I mean? I don't
Yeah.
know. So it's just like I don't know. I feel like that transition's a little bit easier. But I agree with you. I usually say like introduce in a neutral environment, slowly bringing into the house, you know, maybe even keeping them separated where they can get used to each other's smell and things like that first.
Like it'd be cool if they could smell each other under, because I say neutral environment, but I also say don't bring your puppy to a park. But anyway,
Exactly.
so I'm
so
like,
hard.
Yeah, so it's hard. And I mean, I have never introduced my dogs in a neutral environment. I brought my dog home.
Right.
But, you know, if you have a dog that you know is reactive or something, I mean, yeah, like letting them sniff even like through a fence or under a door and giving them both treats at the same time or something like that. Something that you just know you can just positively reinforce their interactions.
Right. And if you have like a dog, an adult dog that you know is reactive to other dogs, it wouldn't be a bad idea to consult with like a trainer first before bringing a puppy into the house, just to be sure that like, I mean, we're not behaviorists, you know what I mean?
Yeah.
Like, but it's like, you know, it's not a bad idea to be like, okay, am I doing this the right way? What's the safest way to do this?
Right.
You know, just before you bring that puppy into your house.
Yeah.
And I did kind of want to circle back to the parvo thing and how it's safe for your puppy to be around other dogs in your house that are fully vaccinated. And the other thing I will say in addition to that is, and this is just what I tell people, just make sure that other dog isn't like going anywhere, or it could be like carrying like fomites or something on its skin, like, or on its fur, and like pass it to your puppy. So I would just say like maybe everybody's hanging out at home until
until the puppy's fully vaccinated.
Exactly. And maybe that's overkill, but I do like I just
smart.
think
That's
like
smart.
I'm like, you know, I don't know, maybe they could pick something up somewhere, and because
Like,
they're vaccinated, they're not
going to
sick.
show symptoms,
Yeah.
but they might bring home something from the dog park on their feet, and
exactly.
then now the puppy's exposed.
So, and I think like if you take your dog on a walk and stuff like that, that's fine, you know what I mean? But it's like if you are going to a dog park, or you're taking your dog to a pet store, or maybe you know your other dog was exposed to a dog that had parvo or some kind of illness, you know what I mean? Maybe stay away from those types of situations until the puppy's fully vaccinated. And then another thing that I know we wanted to talk about was, like, let's say your puppy, like we talked about how puppies chew on stuff a lot, and they get into things they're not supposed to. I mean, that's just like part of it, right? But I think it's good to know that some common toxic things in your house, maybe to avoid, would be like, obviously any medications or anything like that. Like if it falls on the ground, like they're gonna wanna try and snatch it up. If they do eat something like that, contact us right away. That's not good. You know, foods and stuff like that. So like onions are toxic, garlic is toxic, grapes are toxic. So, like those are things that like maybe you are fixing or you're eating or something like that. If that falls on the floor and they eat something like that, let us know. You know what I mean? Chocolate, especially dark chocolate, you know. We don't really want them eating human food, but for the most part, it's like, okay, they might just like have some diarrhea or vomiting, but it's not gonna kill them. But there are some things that can make them really sick. You know what I mean? So it's good to know about the chocolate and grapes, onions, garlic.
Side note, not food related, sago palm, very toxic.
Ooh, good one. Yeah, like, that's good.
Like, I don't know, get rid of your sago palm. Don't let the puppy around the sago palm.
Yes.
The seeds are toxic. The leaves are toxic. It's highly toxic.
Oh,
and the seeds are like little balls, so
they want to
puppies
play
love
with
to
it.
chew on those.
Yeah, exactly. So I think that's a really good one. Yeah, I didn't even think about that. But lots of, plants and stuff like that. Just check and see what you got in your yard before you bring that puppy home.
Yeah.
Yeah. Well, thank you guys for hanging out with the 4 blonde docs today. We had so much fun talking about puppies today, and we will see you next time.